Hi YouTube family, it is Seeking Mini-Me, Seeking Mini-Me VSG, also known as Tiffany here, and I want to do a quick update. It is not my 1 week post-op update yet, it's still early. I'm about 5 days post-op from VSG, but I have a lot of things that I wanted to talk about, and I know some of you who are following me are curious to kind of know how the surgery went and everything, so I wanted to go ahead and do a video why all this stuff is kind of fresh in my mind. So, my stats are going to be down below. I don't want to take the time to go over all my stats just because I think this is going to be a long video. I have a lot of things that I want to talk about and I'm trying to cut down the length of the video. So, I'm not even sure what I'm going to title this video, but I think it's probably going to be something like, you know, some of the things that I wish I would have known or just been prepared for maybe before having the surgery. I know a lot of people talk about how they went through a stage where they regretted the surgery, and that is not how I'm feeling right now. I don't regret it. I'm glad that I've done it so far, but there are some things that I am kind of struggling with. So I just wanted to talk to you about that for you guys. Just so, you know, maybe there's some people out there that are about to have surgery or, you know, that will be having surgery and that this might be helpful for them. So let me start off with, I want to talk about a little bit about my hospital stay. So my surgery was Wednesday, November 22nd. And I had to be at the hospital by 10 a.m. So when I got to the hospital, it was pretty typical. I've had a couple of surgeries before, but basically you go in, you check in, they get all your information, verify what surgery you're having, all that kind of stuff. Then they bring you back, and then a nurse gets with you so you know you can get in your hospital gown, so you can they can put an IV in, check your vitals, like all that kind of stuff. They're just getting you ready for surgery. And I don't think I was waiting too long in the waiting room after that. Went straight into, you know, the anesthesiologist and then the nurse came back to get me and took me to the surgical room. They gave me something in my IV. They said it was like some kind of magical cocktail or something, which it was. I was pretty out of it after they gave that to me. Like, I do remember leaving the room and going down the hallway and the anesthesiologist was like singing some song, and that's pretty much it. I remember like little bits and pieces. Like I think I remember being on the operating table and them like covering me up with blankets. I'm not really sure. I don't remember moving from the table to the operating table, or, you know, from the to the operating table. I don't remember that. It was just crazy. It was almost like I was in a dream. Like I just know bits and pieces of it. So anyways, you know, I went under, and then of course I woke up in recovery. Apparently I was in recovery for a while because I guess the anesthesia kind of had a real impact on me. This happened before too. And I don't breathe because my body's like tired, so I like forget to breathe. I don't know, but I don't remember that. But they did have me on oxygen for a while and stuff like that until like my body woke up more. So I was in the recovery longer than they expected. But no like major complications. Everything went smoothly. Dr. Hall which is my surgeon, had contacted my husband and said that everything was great. There was no complications. He did do a pouch test where they basically fill up your stomach, or fill up your abdomen cavity or something like that, and then test your pouch to make sure there's like no bubbles, there's no leakage or anything like that. And apparently when he did that, there was some, he called it drainage or something. So they just put some extra like titanium clips in there to kind of reinforce things. So yeah, everything went smoothly with the surgery. I woke up in recovery, and I was in pain, but I did not want to take any narcotics. So the nurse knew that I was in pain apparently because my, I think it's my diastolic blood pressure, the bottom number, was really elevated, and I guess that's a sign that you're in pain. So she was going to go give me Dilaudid, and I was like, no, 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 please don't give that to me. So I did suffer from a lot of, it didn't feel like pain from like the surgery, like it wasn't my incisions. It didn't feel like it was my stomach. It was gas pain. It was 100% gas pain. It was bad. I have a pretty high pain tolerance. Like after my C-section, I didn't need narcotics except for maybe the first day or so. So I feel like I do have a pretty decent pain tolerance, but the gas in my abdomen was horrible. This is my puppy Loki. This is the boy. He's a little needy. Sorry, I'm not paying attention to him. So yeah, the gas was absolutely horrible. It was in basically the top part of my stomach most of the time, and it was just very painful. I could feel it moving around in there. I could feel it, like it would come, it would like get really intense, really painful, and then kind of ebb off, and kind of just keep doing that for that. I suffered from really bad gas pain for, I want to say, around 3 days. And again, because I wasn't taking narcotics, I'm sure that made it worse. Or, you know, like, I'm sure it could have been managed a little better with some narcotics, the pain, but narcotics make me really, really sick. So I chose that I'd rather be in pain than be constantly sick and vomiting and stuff like that. Because I already get sick from anesthesia, so I didn't want to add narcotic sickness on top of anesthesia sickness, because obviously retching and stuff like that is really painful on the stomach where, you know, you just had surgery. So I didn't want to add all that on top of that. So I did forego taking pain medication. I was taking, I think it's called Toradol, and it's a type of like liquid ibuprofen, I think, or something like that. I was taking that through the IV, so I was getting that every 6 hours, except for there was a time on the end of day 1, starting into day 2 at the hospital, there was a nurse who was very difficult and didn't want to give me the medication, saying something to do with the pharmacy, even though I was allowed to have, it wasn't even a narcotic, and I was allowed to have it every 6 hours. Anyways, that was the only negative experience that I really had, because, you know, I was due to have the medication, and I was in a lot of pain the first time that I was due to have it again, and he was trying to tell me I couldn't have it until midnight when I was allowed to have it at 9 p.m. That would have been 6 hours because my first dose was 3 p.m. So anyways, that was a big fiasco, which I talked to my surgeon about that, and he let the charge nurse know, so hopefully they'll take care of that so that doesn't happen to anybody else. But aside from that, everything was good. I walked a lot. I walked a lot in the hospital. Like I said, the pain was really bad, and walking, standing was really the only position where the pain wasn't too bad. When I was laying down in bed, pretty much any position I turned to or whatever, the pain was really bad. So standing and walking, I wasn't in a lot of pain when I was doing that. So that I did a lot of walking that everybody on the floor was talking about me, because they were all like, we're going to give you a medal for as many laps as you have done. Like, you are definitely the #1 walker that we've ever had. So everybody was just like amazed with that. But I did it because I was in pain, and standing and walking helped me. So I was just trying to, you know, I mean, I know it's good for me. I don't want any issues with blood clots and all that kind of stuff too. So I had other reasons for walking, but that was my main reason, was walking. Because again, I was hoping to help break up the gas and get it out of my system, as well as it wasn't painful when I was standing, so I would walk a lot. So yeah, I didn't bring much to the hospital. I knew going into the hospital, like I said, this wasn't my first hospital stay, that I wasn't going to use anything that I brought, pretty much. You think of all these things that you're like, oh, I might need this. Oh, I might need this. Oh, I might need this. You really don't. You don't need any of that stuff. I brought one set of clothes, I brought chapstick because that is one thing that I do recommend, because you're kind of dry, your mouth is dry and all that stuff, and right now my lips are chapped. Like, that's what I'm wearing is chapstick. So I did bring some chapstick. I brought obviously my phone and my phone charger. Those are pretty much the only things that I got out of the bag. I ended up putting the clothes back on that I came in with. So the extra outfit I didn't even need, but that was just a precaution just in case, like, you know, something happened. So yeah, I packed very little. I did bring bath stuff thinking that I might take a shower because I wasn't sure if I was going to be staying 1 or 2 days. But I ended up not needing that stuff because I only stayed overnight 1 day. Which, that's something else that I want to talk about. So I had surgery on Wednesday, and the next day was Thursday the 23rd, which was Thanksgiving. So on Thanksgiving, when my surgeon came to see me, you know, we were talking about, I was still on IV fluids because on all day Wednesday, I couldn't keep anything down. I was really nauseous and I felt really bad. And I couldn't really keep anything down. I wasn't sipping water. I wasn't doing anything. I was in so much pain. I was so uncomfortable. When I did sip on something, it made me super nauseous, and most times I threw it up. And I know other people have said, like, when they throw up, they don't retch. Well, I do, and it hurt. So I was trying to avoid throwing up if at all possible, so I wasn't drinking anything. So I was on IV antibiotics still when the doctor came and seen me. But I wanted to go home. I wanted to be home. I hate being in the hospital, so I wanted to go home. So when and like I said, it was Thanksgiving, and my husband was there at the hospital with me, and so was my daughter. They both stayed, like, they were there when I had surgery on Wednesday, and then they stayed overnight Thursday. My husband ended up taking my daughter, dropping her off with her uncle because they were doing Thanksgiving dinner at our house. So she could enjoy Thanksgiving dinner, but my husband wasn't going to leave me alone. He didn't want to leave me alone in the hospital because he knows how I am about hospitals. I don't like to be left alone, so he was going to stay there with me if I had to stay another night, because the nurse was saying that's probably what's going to happen because I can't keep anything down. So the doctor came and saw me, and by that time my husband was back, and you know, we talked about some things. I talked about the concern that I had with the pain medication. Talked about my nausea, that I was still having issues with nausea and stuff, and he basically just asked me, he's like, well, do you want to go home? Like, how do you feel? Do you want to go home? And I was like, yes, I want to go home. Even though I probably shouldn't have. The reason why I say that is because I did go home Thanksgiving, and all day Thanksgiving, and even Friday, all day Friday. I had a hard time keeping anything down. Even just drinking water was painful. Drinking Powerade Zero, it's not painful going down, but yet it gives me heartburn. That's another thing. I have so many things to talk about, guys. I'm sorry if I jump all over the place. But yeah, drinking water was really difficult for me. It hurt. It was painful going down. Before I left the hospital, they gave me a patch that goes behind my ear that helps with nausea, and that was really, really helping. So luckily it was painful, but I wasn't vomiting when I was drinking, so that was good. Like, I don't think I've officially vomited. I've, like, dry heaved, but nothing's really come up a couple of times since leaving the hospital. But that patch, it lasts for 3 days, and it really did help my nausea. So I can't really explain it. I've always been a huge water drinker. Huge. I drink a lot of water every day. And going from that to going from, like, barely anything, it's been hard on my body. I can feel it. Yeah, so yeah, drinking was just hard, and like I said, it's hard to explain, but when you have so much gas pressure in your abdomen and it hurts, I was still in a lot of pain when I was coming home. So Thursday and Friday, I was still in a lot of pain. So about 3 days after surgery, I was still in a decent amount of pain. And the combination of that, along with the kind of really, I wouldn't call it pain, but it was like uncomfortable. I could feel the liquid, like the water moving in through my, down my throat, through my esophagus and into my stomach, and where it would kind of like, the best way I can explain it is, when you're like, I don't know if this happens to everybody, but you're like super hungry. Like you went a long time without eating for whatever reason, and you're super, super hungry and your stomach is growling, but the growling feeling is almost painful. That's how it felt when I was swallowing any time I would swallow. So it just made it difficult for me. I've gotten better with water. Speaking of which, I can drink more water now. So once the kind of gas pain finally subsided, which really was Wednesday, Thursday, Friday were pretty severe pain. Like I would feel better, and then it would like come on really bad at night for some reason. It would move. Like Friday, it was like moving into my shoulders and moving into my whole right side. So I couldn't even take deep breaths. It was like really, really painful. Saturday it started to get better, but Sunday, yesterday, was the first day that I really felt like normal, that I really felt, we got up and we went to the mall and walked around the mall all day. Well, not all day, for maybe like 3 hours or something. And that was okay. I didn't get that pain in my shoulder from like the gas moving into my side was there a little bit, but it subsided pretty quickly. And I came home, and last night was the first night I was able to sleep without any pain medication or anything. So yeah, that's that. What else did I want to talk about? Heartburn. Yeah. 1 second. Heartburn. I have not had heartburn before the surgery. I did not have any issues with heartburn before the surgery. Like I can still feel the water like moving into my stomach. I had occasional heartburn before the surgery, and that was only due to things that were my fault. If I ate too much right before going to bed or something like that, I would get heartburn. The first night when I was in the hospital, they were giving me Pepcid through the IV. The first night I came home, obviously I wasn't getting the Pepcid anymore. So the first night I came home, I did take one pain pill, one of the, I think it was Norco. Yeah, Norco. I was taking one pain pill at night because I was still, like I said, in a decent amount of pain. Throughout the day, it's manageable, but it would keep me up at night. So I would take one at night so I could at least sleep, because I know sleeping was, needed to happen. So I would take one at night. I woke up that first night twice where the acid literally woke me up because it was shooting up my throat and into the back of my throat. And I had to woke up, and I almost thought I was gonna throw it up, but it was it wasn't throw up, it was acid, and it burnt, the back of my throat burnt. That happened to me twice that first night. So after that, I noticed that even I've been getting heartburn throughout the day. Even I said, the Powerade Zero. Whenever I drink that, I get heartburn. So I started taking Pepcid AC because it's over the counter. So I started taking that at night before I go to bed too. And I think that lasts 24 hours if I'm not mistaken. Because I'm not sure, because I don't have the package. A friend of mine gave me a couple of her Pepcid AC to see if that helped. And so I think that stuff lasts for 24 hours, because right around the time, around 8 o'clock at night, when I usually take it, the next day around 8 o'clock at night, the heartburn comes back and I start feeling it again. So I'm pretty sure that Pepcid AC lasts about 12 or 24 hours, because at night it seems to come around and I start feeling bad again. So that's the first thing that I know that people had talked about it, but I didn't. I had heartburn before, like I said, but it was very rarely, so my doctor didn't think that I was going to have any issues with heartburn. Well, I do, apparently. So I'm going to have to talk to him about that on my follow-up. I don't know if that's a common thing. Maybe it'll go away once my stomach's not so angry and mad at me. Maybe it'll go away. I don't know. So I'm going to talk to my surgeon about that. So that's the first thing. The second thing is the dehydration. I know without a doubt this is the reason why I said I probably should have stayed a second night to get IV antibiotics, because I know without a doubt I was severely dehydrated Friday, most of Thursday, because I was on IV antibiotics like half of Thursday, because I was still in the hospital. So once they released me, like, you know, Thursday night, Friday, and probably even into Saturday, I was really dehydrated and my whole body could feel it. The first thing I noticed was my nose has been bleeding. I've never gotten a nosebleed before in my life. Excuse me, guys. It's every time I drink something, it makes me burp. I don't know why, which I'm not complaining about because that's just more gas that's going to be leaving. But anyways, so yeah, I was extremely dehydrated, and my first sign was my nose has been bleeding. Now, it's not coming out. It's not like a profuse bleed, but if I blow my nose, if I, you know, like if inside of my nose, if you look in the inside of my nose, like all my, this might be TMI, but like all my boogers and all my mucus and everything like that, it's all covered in blood. So my nose has been bleeding. That's one thing that I had no idea could possibly happen. Something else is, dry mouth. My mouth has been so dry and so disgusting. My lips are chapped. My pee smells horrible. Again, that might be TMI, but it's the truth. I can tell in my body that I am dehydrated. Yeah, it's been a real struggle. Like, the other thing that I've been struggling with is I never thought that I would ever go 4 days without consuming any sort of food. 4 days. Like, that is insane to me. On Tuesday at I couldn't have anything to eat or drink, obviously, after Tuesday at midnight. So I didn't have anything Wednesday. I didn't have anything Thursday. I didn't have anything Friday. And I didn't have anything Saturday. It might have not been a full 4 days. I think Saturday night I finally consumed something that could be considered food, but it was very, very little. So yeah, honestly, like, I forgot to tell you guys, but, I did go ahead and get on the scale just because, you know, so if you guys who are following and kind of want to know, like, about where weight loss is happening and stuff like that. I've been out of the hospital, after my surgery. It's been 5 days since my surgery, and I did get on the scale this morning, and I was at 190.1. So when they weighed me, I'm going to use the hospital weight that they got me, which was 195.6, which is what I weighed in at the hospital on 11/22. So it's 11/27 now, and I weigh 190.1. So I've lost a total of 4.5 pounds in the first 5 days after surgery. Did I say 4? 4.5? I mean 5.5 pounds. I lost a total of 5.5 pounds. Oh, something else that I didn't realize. Like, I have no idea where this is coming from. I can only assume probably from lack of nutrient intake, lack of water, and all that kind of stuff. My vision is messing up. I got LASIK eye surgery, so I have like 20/25 vision, 20/20 in one eye, 20/25 in the other. So I have pretty good vision. But I can't see things close up to me right now. It's like, it's blurry. This is just a recent development since the surgery. So that is another thing that I had no idea. Like, it is not anything I ever expected. Never heard of that happening with anybody else. So that's the only thing I can think of that's causing it. I'm sorry. I still have surgery brain, guys. I'm kind of still in recovery mode. But yeah, so I'll post my stats down in the comments too. So yeah, I'm already at 24 minutes. I told you guys I had a lot of stuff that I wanted to talk about. So I want to make a couple of shout outs, and then I'm going to stand up and see if I can give you guys a little bit of a shot of my surgical incisions, just in case anybody's curious what they all look great. They all look fine. I have 6 of them, I think I have 6. They're little. I was never really worried about the incisions, but just in case anybody else is curious, I'll show you guys what those look like. I do want to thank some of my new subscribers. I know I have more new people than this, but I think YouTube only notifies me like for some of my new subscribers, so I don't know who all is new, but I just want to thank you guys so much for joining me and sharing my journey with me, because it really means a lot that I have people out there who are, you know, watching my stories, and some of these people are people who have already been through the process and kind of give me tips and help me out, and I appreciate that so much. And some people are, you know, new to the process and are kind of curious to how the process goes and stuff like that. And I appreciate you guys too. Like, I enjoy sharing my story with anybody. So thank you so much for subscribing. Dippy McDip and Fitness Triss. I know you guys are two of my newest subscribers, so thank you guys. I also wanted to say a big thank you to Smile and Shrinking, Less of Me VSG, and Bypass to a Leaner Lynn. You guys have been great. You guys comment on my videos, always trying to give me, you know, tips and trying to help me out and all that kind of stuff. So I just wanted to thank you guys. Smile and Shrinking, if you guys haven't been to her videos, you need to check her out because she's really amazing. She's an amazing person, and I love her, and I love watching her videos. And she just recently had plastics, so if you're curious about that, she had a huge number of weight loss. She's just an inspiration. So definitely check her out, as well as Less of Me VSG and Bypass to a Leaner Lynn. They're great. And they've been so helpful and so kind, and I appreciate you guys so much. So I just wanted to thank you guys so much for that. So I feel like there's a lot more things that I want to talk about, but this is almost already 30 minutes. So I'm going to show you guys, hopefully I can show you my, I'm going to get up on my knees and hopefully I can show you guys my incisions, and then I will wrap this thing up. So 1 second. Okay, I'm not going to be able to show you guys this way. 1 second, guys. Let me move you back. And bring this down. Okay. Okay. Hopefully you guys can see that all right. Okay. So I have this top one here. This one, the worst part about this one is where it's located. See, like, all I did was get up from a sitting position and I'm like barely breathing. But anyways, this is the top one. This is from, this is the only one that really bothers me because it sits like right under my bra. So this is the only one that's really aggravating me. I also have this one. I barely even feel these incisions, guys. Like, sometimes when I twist the wrong way, I might feel it, but that's about it. This one here, and then this one down here, kind of in the side of my belly button. That one's the only one that I worry about just because of its location, because I kind of, when I'm sitting, might kind of see how it kind of creases there. So hopefully that one won't have any issues. So that's 1, 2, 3, 4. Then I have this one here, which is 5, and then this one over here, which is 6. These, honestly, the doctor says that they look good. He's not concerned about them at all. Neither am I. Obviously, you can see there's a little bit of bruising, but they're really not painful, guys. I really don't even notice that they're there. They don't bother me at all. So if you guys are like worried about the incisions and whatnot, I think they're going to heal fine and probably not going to be even able to see them. So I'm not worried about the incisions, but just in case you guys were curious, those are my incisions. Kind of got a shot of my lovely belly too. That's like my biggest problem area, guys. So yeah, I don't know why I have the nerve to be able to show that to you guys. I really don't know, because I don't go out in public and show. I guess you guys are just so awesome and you guys know and understand my process and my path and stuff, so it's not a big deal for me to show it to you guys. But anyways, I'm gonna wrap it up. I'm sorry that this is such a long video. I just had so many things I want to talk about in regards to the surgery. I still feel like I might have things to talk about, so maybe I will do a week 1, so like in 3 days do a week 1 update with an official weigh-in and stuff like that for my first week. I'm not sure. But anyways, thank you guys so much for watching. If you have any questions, please feel free to leave them down in the question section or in the comment section. I'll be glad to answer those for you guys. And of course, if you want to follow my journey, I would appreciate if you guys subscribed. I do plan on doing pretty regular videos to kind of just keep you guys updated on my progress and how things are going. So yeah, thank you guys so much for watching. I hope you have a wonderful day, and I hope you had a wonderful Thanksgiving. That's it. Bye, guys.